Hi everyone, myself I am Dr. Krishna. In this video we are going to learn anterior triangles of the neck, which was made as easy as possible. Anterior triangles of the neck lies between the midline of the neck as well as the sternocleidomastoid muscle. It is further divided into smaller triangles. Anterior triangle has three boundaries. They are medial by the midline of the neck, lateral by the sternocleidomastoid muscle, and superior by the base of the mandible. You can see here clearly medial by the midline of the neck, lateral by the sternocleidomastoid muscle, and superiorly by the base of the mandible. Or you can also say that from the line joining base of the mandible to the mastoid process. Anterior triangle is further subdivided by digastric and superior belly of omohyoid muscles into submental triangle, digastric triangle, carotid triangle, and muscular triangles. Now let's see the submental triangle in our further video. Submental triangle is the median triangle that is bounded on each side by the anterior belly of digastric muscles and base is formed by the body of the hyoid bone and the apex is formed by the chin. The floor of the triangle is formed by the union of right and left mylohyoid muscles and median raphe uniting them. Contents of the triangle are 2 to 4 submental lymph nodes and they drain the central part of the lower lip, adjoining gums, anterior part of the floor of the mouth and tip of the tongue. And there are 2 submental veins unites to form anterior jugular vein. All about the submental triangle. Now let's see the digastric triangle. Let's start with the boundaries of the digastric triangle. Antero-inferiorly, the digastric triangle is bounded by anterior belly of digastric muscle. Posterior-inferiorly, it is bounded by posterior belly of digastric muscle and stylohyoid muscle. And superiorly, it is formed by the base of the mandible and line joining base of the mandible to the mastoid process. The roof of the digastric triangle is formed by the skin, superficial fascia containing the platysma muscle and cervical branch of the facial nerve and ascending branch of the cutaneous nerve. Beneath the skin, there is the deep fascia that splits to enclose the submandibular salivary gland. Now let's go to the floor of the digastric triangle. The floor is formed by the mylohyoid muscle anteriorly and hyoglossus muscle posteriorly, and the small part of middle constrictor of pharynx is also visible. Muscles form the floor of the digastric triangle, and the contents of the digastric triangle are superficial part of submandibular gland, facial vein, submandibular lymph nodes, submental artery, mylohyoid nerve and vessels, and hypoglossal nerve. I repeat, superficial part of the submandibular gland, facial vein, submandibular lymph nodes, submental artery, mylohyoid nerve and vessels, and hypoglossal nerve. These are the contents of the digastric triangle. Digastric triangle can be divided into anterior and posterior parts. In the posterior part of the triangle, there are lower part of the parotid and external carotid artery and deep structure passing between the external carotid artery are styloglossus, stylopharyngeus, glossopharyngeal nerve, pharyngeal branch of vagus nerve, styloid process and part of the parotid gland. These are the deep structures that are present in the external carotid artery. Deep structures includes internal carotid artery, internal jugular vein, and the vagus nerve. Now we have completed two triangles and now let's move to the carotid triangle. Let's see the boundaries of the carotid triangle first. Its superior boundary is formed by posterior belly of digastric and stylohyoid. Posterior boundary is formed by sternocleidomastoid muscle and inferiorly by the superior belly of the omohyoid muscle. The roof of the carotid triangle is formed by the skin, superficial fascia containing the platysma and cervical branch of the facial nerve and transverse cutaneous nerve of the neck, and also the investing layer of the deep cervical fascia. These forms the roof of the carotid triangle. Now let's move to floor of the carotid triangle. The floor is formed by the parts of middle constrictor of the pharynx, inferior constrictor of the pharynx, and the thyroid membrane. We are now done with floor and roof of the carotid triangle. Let's see the contents of the carotid triangle. The common contents of the carotid triangle are common carotid artery, carotid sinus, and carotid body and its termination, and also we can clearly see bifurcation of the carotid into internal carotid and external carotid arteries, and we can also see that few branches of the external carotid artery, they are superior thyroid artery, lingual artery, and the facial artery, and ascending pharyngeal artery and occipital branches. These are all the branches of external carotid artery that you can see in the carotid triangle. Apart from the arteries, we can see the veins. They are internal jugular vein and common facial vein that draining into the internal jugular vein, and the lingual vein which also terminates into the internal jugular vein. These are the most common veins that you can see in the carotid triangle. Let's see what are the nerves that are present in this triangle. The main nerve that is present is vagus nerve and superior laryngeal nerve that divides into external and internal laryngeal nerves. These nerves supplies to the larynx, and other nerves are spinal accessory nerve and hypoglossal nerve and sympathetic chain of nerves. These are all the nerves that are present in carotid triangle. Yeah, we are done with arteries, veins and nerves of the carotid triangle. Now let's move to lymph nodes. Deep cervical lymph nodes that present along the internal jugular vein include jugulodigastric node and jugulo-omohyoid node. Last but not the least is the muscular triangle. The boundaries of the muscular triangle are anterior boundary by the anterior midline of the neck that extends from the hyoid to the sternum, and posterior superiorly by the superior belly of omohyoid, and posterior inferiorly it is formed by the lower part of the anterior border of sternocleidomastoid muscle. Now let's move to the contents. Contents of the muscular triangle. The contents of muscular triangle are mainly made up of infrahyoid muscles. They are sternohyoid, sternothyroid, thyrohyoid and omohyoid muscles.